And this is such an important part of vulvar health and vaginal health, is actually looking and being aware of what's normal and what's healthy and what's not.
I want to switch now and talk about vaginal dryness, especially with your book coming out, Slip Sliding Away, and then women coming in, again, one complaint that creates disconnect in a relationship, creates loss of libido, is if we have pain every time we have sex. And I always tell clients, if you have pain every time you do something, why would you want to do it? Of course, you're not going to want to have sex.
Yeah, vagina's not stupid. And
it's
when
not stupid.
And they say, I have no libido. And then my next question is, well, when was the last time you had intercourse or tried to have intercourse? And they'll say, oh, like 6 months ago. And I'll say, and how did it go? It hurt like hell. Okay, well then it's no mystery why you have no libido, because your vagina is not stupid and your vagina is saying, don't go in there. This is going to hurt. So that's actually our approach to libido, is we first fix the pain. And then we circle back and say, how's your libido now? And if they're still having issues, of course, then we deal with that because it's so multifactorial. But you have to fix the pain. But when I talk about vaginal dryness and my book, Slip Sliding Away, I think we really need to also address the bigger picture, because yes, of course it's about pain with intercourse and it's about sexual relations, but it's also just about vaginal and vulvar health and the impact that that has on so many other things. I mean, you know the way I know, women do not associate the fact that they have recurrent bladder infections, urgency, and that constant gotta go feeling with the fact that their vagina and their vulva are starved for estrogen, because this impacts those tissues as well. So while I do, of course, address the sexual issues in Sleep Sliding Away, I give equal time to talking about the non-sexual issues, because a lot of women think that the only reason to use a product on the vagina or the vulva is if they want to have sex. And oh my God, no, it's just to be comfortable. It's to get rid of the urinary symptoms. It's just to have vulvar and vaginal health.
I love this conversation because it's so important, it's so critical, and it affects us. It will affect every one of us. I always say, like, we get wrinkles on our face, right? We're getting wrinkles down there. That's affecting the most important real estate of our body, which is clitoris to anus. Let's not forget any part of it. I mean, clitoral atrophy, we think of that, anal fissures, hemorrhoids, that just creates such discomfort in quality of life, just for men and women, right? So it goes beyond, and not just vaginal pain with intercourse that keeps women from having sex, but it's the odor after, the discharge, the discomfort for days, the urinary tract infection after that often come into play. But that right in that same area, it's not just about dryness, it's incontinence, it's prolapse, it's pelvic discomfort, hemorrhoids. I mean, all of this area. That's why it's most important real estate.
Well, the other thing, when we talk about real estate, and I know you and I are on the same page about this, is it drives me nuts when people keep talking vagina, 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 when it should be vulva, vulva, vulva. 90% of the time when a woman comes in and she says, I have a rash or I have an itch or I have this in my vagina, she's talking about her vulva. And I keep talking about the poor forgotten vulva, because so many times when we talk about failures, the woman who comes to our clinic, and I'm the medical director of a sexual medicine clinic, so we see women who say, there's something wrong with me because I went to my doctor and they gave me a prescription for a vaginal estrogen insert, and I used it faithfully and it still hurt. And then I do an examination and I say, well, the reason that it hurt is because you have treated the vagina very nicely, but you have not treated the entry to the vagina or the vulva. And it doesn't matter how nice the room is if you can't get through the door. So we need to treat the vulva as well. And you're not broken, it's that your vulva desperately needs help. And I know you experience the same thing with your patients, because we see the failures. People come to us saying, no one else has been able to help me. And it's because the right thing is not being addressed.
I agree 100%. It's why I created Julva as a topical cream to be used, on the clitoris, on the vulva, at the opening. I mean, just to be used topically and just massage it in, use it as a lubricant, use it, as your part of your daily cosmetic routine. I mean, it's just critical, this area, because every one of us, I mean, like we treat generations of women. Every one of us will get atrophy, thinning of the skin, pain and discomfort as we age, unless we intervene. And the sooner we intervene, the better.
You know, the other thing also is, and again, you know, the two of us, it's like we could be having the same things coming out of our mouth. But when we talk about paying attention to the vulva and the clitoris and the labia, if you put a sign with the parts and said to a woman, label the parts, we know that the majority of women are not able to label their own parts of their genitalia, because as I always say, you know, guys have the advantage of they look down and it's right there. They don't have to figure out where everything is. For women, it's much more of a mystery. And in our clinic, we see so many women who have never had an orgasm, and it's not because they have anything wrong with them. It's because they don't know where their clitoris is, and because they need to be told that there has to be clitoral stimulation. But to your point, when we talk about vulvar vaginal dryness and addressing the entire vulva, including the clitoris, because a lot of times women can't have an orgasm, and it's simply because the tissue is so dry and the blood supply has diminished because of the lack of estrogen. And it is sometimes as simple as putting a little estrogen on the clitoris to increase the blood flow, to increase the health of those all important teeny tiny little nerve endings that will enable them to have more sensitivity. But it really starts with saying, we have to educate women. You know, we use a mirror in our clinic. Every woman that comes in, we get the mirror out, and half of them go, oh, yeah, well, look. No, we don't force people to look, but we really encourage them, because they don't look at their vulvas. Women have this idea that they're not attractive, that they don't look a certain way, that their labia are too long, that their pubic hair is too full, that, you know, whatever. And they don't look. And this is such an important part of vulvar health and vaginal health, is actually looking and being aware of what's normal and what's healthy and what's not, so that we can address it.
And knowing your own anatomy, like we talk about doing your self-breast exam, knowing your own anatomy. What does it feel like? What does it look like? How is it changing? You know, and that's a really important aspect. So are you tired of getting up once, twice, or even 3 times a night to go to the bathroom? Well, it's not uncommon, especially as we get older, and it interferes with our sleep, and often we wake up not feeling rested. The issue is this bladder urgency or leaky bladder issues that we do not have to suffer with. A client, Cindy, started using my product, Julva, which is my all-natural feminine cream that we use on our lady bits. And before you knew it, she started sleeping through the night, not having to get up most nights now, and has more energy during her days. So I want to invite you to try Julva, and for a limited time, because you're watching the show, go to dranna.com and use the code SHOW10 to get 10% off your first order. Walk us through an examination. Well,
I always tell people when they come to the center that they're going to have an exam unlike any exam they've ever had, because every woman that goes to the gynecologist for her annual pap and exam, I mean, first of all, you're in and out the door in about 14 seconds. And in general, and there are exceptions, there are good gynecologists like you and me who pay attention. So I don't want to make it sound like they're, you know, we're the only ones. There are good gynecologists out there. But we know that many gynecologists, basically, they talk with you for a few minutes. Once you get up in the stirrups, they put that speculum in, they do the pap, and they do the bimanual to check the uterus and the ovaries, and then they're done. We do about 20 other steps. So the first thing we do is first of all, part of our exam is actually talking to someone in their clothes for a long time before we have them get undressed. But when we do the exam, and I'm going to stick specific, I'm not going to get into breasts and abdomen and all, thyroid and all those other important things we do, but just as far as the vulvar and vaginal exam. So the first thing we do is we get that mirror out, and then we take a Q-tip, and as the woman is watching, we go through and we literally touch every part. We start on the outside with the labia majora. We then move into the labia minora, to the vestibule, which is the opening to the vagina. We then go up and we point out the clitoris. We point out the hood of the clitoris. It should retract, meaning it should slide over the clitoris, because that's what happens with healthy tissue. And we also just look at the skin. There are a lot of skin conditions of the vulva that get missed. Things like, lichen sclerosis with even precancers, cancers, psoriasis. So we pay a lot of attention to the skin itself. And we haven't even gotten our speculums out of the drawer yet. We are just looking, and talking, explaining anatomy, explaining what these things are. If someone is having pain, we then do what's called a Q-tip test, which is very simple. We take a Q-tip and we touch the various areas of the vulva to see, where is your pain? How much pressure does it take to cause the pain? If we have someone who's having problems with orgasm, when we look at the clitoris, in addition to looking at the size, as we look at the color, is it pink? Does it look healthy? We do a little neurologic exam of the clitoris, because a lot of women who can't have an orgasm, they think that there's something neurologically wrong. We make sure, can you feel pressure? Can you feel temperature? Can you feel sensation? Those are all critically important in terms of determining why someone isn't able to have an orgasm. And then, only then, do we start to look inside. But the one last thing we do before we look inside is we measure vaginal pH, because vaginal pH, more than anything else, is going to inform us about, is there a healthy microbiome, the healthy bacteria that are in there? What is their estrogen level inside the vagina? And this is like 2 seconds. We take a little piece of paper, pH paper, we put it inside, and it tells us if it's in that healthy 3.5 to 4.5 level, or if it's high. If it's high, it might be menopause and low estrogen, it might be an infection, but those are all things that need to be taken under consideration. And then we put the speculum in, as small as possible, by the way. One of my most popular articles on drstreicher.com is, one speculum, one size does not fit all, because women are just, but that's a whole nother topic. But anyway, so once we put the speculum in addition, if someone needs a Pap test, of course we do it, but we are really looking at the vaginal walls to make sure that they're the right color, that they have those nice little wrinkles that you need in order to expand, in order to have normal elasticity. Do we see some normal lubrication? All of that. So we pay a lot of attention to that. And then after we remove the speculum, of course, yes, we check, like every gynecologist does, your uterus, your ovaries, to make sure that they're in the right place and the right size and they don't hurt. But then we do the most important part of the exam for a woman who's having pain, and that's a pelvic floor evaluation, because all of those muscles that are supporting the vagina, the bladder, the rectum, everyone always thinks about having strong muscles, and it is important to have strong muscles in terms of thinking of like incontinence and all of that. But just as important as having strong muscles is having muscles that are able to relax. Mm-hmm. Because so often we talked about, with pain, what happens is people go into like, oh my God, this is going to hurt mode. And what we need to appreciate is that the pelvic floor muscles, when we say that don't go in there, defense mechanism, it's the muscles talking. Right. So we do an evaluation of the muscles to see if someone would benefit from pelvic floor physical therapy. And I forgot one thing in my vulvar exam that we do before we put the speculum in, and we look at the urethra. We take a very careful look at the urethra, which is of course the tube where the urine is coming out, because a lot of women that are having urgency or recurrent urinary tract infections, we can actually see changes in the urethra, something called funneling, that it's kind of popping out. I always tell the medical students when I'm teaching them that this is going to be one of their number one indications of a woman who has vaginal and vulvar tissue that really needs estrogen, is if the urethra is like popping out. And so these are easy things, and they give us so much information, but quite frankly, these are not things that happen at a routine gynecologic exam.
Right. It just happens in a blink of an eye, and it's not a thorough evaluation. And I know you're looking too at the anal skin too, when you talked about the skin down by the anus. And guys, homework tonight for all our listeners, get that mirror out. Take a look. What does your clitoris look like? The vulvar area, the vaginal opening, the skin around, all the way, the band between your vagina and your anus and the anus itself. And how's it look? Are there hemorrhoids? Are there, what's happening there? What does it look like? Is the skin thinning out? I think that is so critically, of course, we're on the same page with that, so critically important.
The other thing also to your point is, when someone looks for the first time, sometimes they get really alarmed because they're seeing something that they've never seen before. And then it's always a question of, well, is this normal or is this cause for concern? And it's because women don't look throughout their life. And I can't tell you how many times someone will come in and say, oh my God, I finally took a look and I saw, fill in the blank. And we'll say, actually, this is completely normal. But everyone has this idea of what their genitals should look like, what their vulva should look like, how long their labia should be. And they take a look and they think, oh my God, there's something wrong with me. There's something wrong with me. And more often than not, they're perfectly normal.
Perfectly normal. And that's a good question too at your gynecology visit. How's everything look? Is it normal? I mean, we've had babies, things change, our anatomy shifts. I mean, this is as we age, but really getting a hold of it. And I do want to emphasize what you said about pelvic pain, hypertonic, spastic muscles causing pain, and being able to feel that, as a gynecologist too, assessing the psoas muscles internally, assessing the pelvic floor muscles internally. What is happening there? What could be causing pain? And also going to emphasize that pH. My audience have my Keto pH test strip. If you have that at home, we just check put a strip in your vagina. It should not change color. It should not change color because the vaginal mucosa, the vaginal environment, milieu, is very acidic. Ideally, and if it starts to go more, deeper yellow or green, you're in that green.
Navy blue, we hate navy blue.
Definitely. That's definitely a sign of a bacterial vaginosis and imbalance and we want to improve that, and we can with vaginal estrogen, vaginal hormones, using Jova, we can see an improvement in that vaginal pH. So, that's what we want, and that makes a difference. So when you're prescribing hormones, how are you going about now your treatment?
Well, so this is the thing, when we look at what our options are as far as having a healthy vagina and a healthy vulva, our treatment is based on which area are we treating, because we divide it. And I might say to someone, okay, we're going to use this for your vagina and we're going to use something else for your vulva. And people never think in terms of that. Sometimes, one thing will do it all and sometimes it won't. So when we look at the local vaginal estrogen, so many women look at that and they think, it's dangerous, and we can get into that about it. It's not using, vaginal estrogen for a year. It's like taking less than one birth control pill. And it is perfectly safe even for women who have a diagnosis of breast cancer. But the other thing that women think is they think their only option is a cream. And while the creams work, and they work very nicely, they can be messy, they can be, not someone's first choice in terms of just what they want to use. And we have so many other options. So as far as vaginal, when I say vaginal, I'm talking again, internal. As far as vaginal options, there's a vaginal ring, S-string. And I go through this, every single chapter in my book, Slip Sliding Away, is a different product that goes through. How do you use it? What are the pros? What are the cons? Because when you go for your appointment, Anna, you talked about how you're in and out the door in 20 seconds, which is most of the cases that is. When we do a consultation for this, it takes us almost an hour. So that's actually why I'm writing this series of books, my Inside Information books, is because each book is like an hour consultation. So everything I'm going to say now real fast, it's all in detail there. But there is a vaginal ring, there's a tablet, there's an insert, there's a cream. All of those things can be used internally. We also know that there's a DHEA, which, that's your world. DHEA is the precursor for estrogen and testosterone, so that you can actually make your own internal estrogen and testosterone by using it. There's a commercial product called Intra Rosa. We also sometimes do it compounded, which will help. On the outside, on the vulva, certainly we can use an estrogen cream. We can use DHEA. We use testosterone. Women forget there are also testosterone receptors that we have to get compounded, but we do that in severe cases because for some women, estrogen alone isn't enough. We have to use estrogen and testosterone together. And then there's the pill, there's the oral pill, Asphena, which is a selective estrogen receptor modulator, which basically just gets those estrogen receptors in the vagina to come alive. And so that's for someone who prefers to put something in their mouth instead of their vagina. And then finally, I have a huge CO2 laser program. I'm a big advocate of the Mona Lisa Touch laser. We have very, very good studies, very good scientific data to show that women who have a CO2 laser treatment do extremely well. And that's because I can treat inside the vagina, I can treat outside, I can treat around the urethra, I can go down to the anus. I really, after I do my vulvar evaluation, I'm able to treat all of those areas using the laser, which increases blood flow, increases collagen, increases fibrin, basically makes the tissue thick and elastic so that when you look microscopically, it looks exactly the same as before someone went through menopause. So we have so much out there. That's the point. There is no way that anyone should be putting up with this and having difficulty, whether it's, painful sex or just discomfort or that urgency, because we have such good solutions.
Oh, we do. We do. And I'm glad you brought up lasers too, because I think there's certainly a place for that. And there's so many out there as well, but they have so much benefit and it's a good complement. We're thinking about facial lasers, thinking about vaginal lasers. I mean, this is an important area to not be afraid. And then again, continuing to exercise the pelvic floor, like don't let those muscles go, just like any other muscles in your body, a part of a normal workout routine. Also asking, advocating, know what options are available to you and being able to, advocate for yourself. I think that's really important.
Yeah, and quite frankly, that's why I wrote my books, because if a woman says, I'm in, rural Iowa and there's not a doctor around for, 100 miles who knows this stuff, but if she reads my book, she can go in there and say, I would like a prescription for a DHEA suppository because I read, and they'll write the prescription, So sometimes, yeah, you do have to know more than your doctor. You do have to advocate for yourself. But I always tell women the number one thing that they need to be healthy and to get the right care is to be motivated. You have to be motivated. You have to say, yes, this is important to me, and I'm going to figure out a way to make it happen.
Thank you for watching this video. Be sure to subscribe to my YouTube channel here and get those notifications, and comment below. Let me know your thoughts, what you loved, and what your action step is.